Hello everyone and welcome to our webinar. My name is Vicky Blake, I'm the UCU President. Today we are joined by Professor Elizabeth Stokoe and Professor Anne Phoenix from Independent Sage, and also UCU's Health and Safety Lead Alex Lancaster. We bring apologies from Joe Grady, who can't make the session today, but we have got lots of great stuff to dig into here today to help you in branches and as individuals to navigate the situation that we're in at the moment with coronavirus. So we'll be looking at the latest data, examining why it's still not safe to reopen colleges and universities, and discussing the next steps we need to see to prevent outbreaks on campuses across the UK, and what branches can do if they're not seeing those steps. UCU is very clear that this is a matter of public health, and that universities and colleges have enormous responsibilities to their local and wider populations. This is a crunch point for tertiary education. Decisions being made now on face-to-face teaching, on the migration of students, and on the further opening up of campuses will directly impact on whether actions across the sector will accelerate the second wave of coronavirus, damaging students, staff, and our communities. So with cases rising, with the infection rate in the 17 to 21 age group at 50 in 100,000 and rising, with the implementation of new measures such as the Rule of Six in England, Scotland, and Wales, making it clear there is a real issue, we are asking, where is the leadership we need from government, and where is the courageous leadership we should be able to expect from our own institutions? UCU has gone on record to point out that this government's delayed update to guidance for universities in England is inadequate, and also that, as expected, where colleges have gone back to face-to-face teaching, we are seeing outbreaks and spikes, and even whole large year groups again in isolation. Where student populations have already started to return in advance of term for universities, we are seeing rises in cases in those areas, and we've also seen reports of widespread parties of more than 30 people. The failure of leadership from government cannot absolve senior college and university leaders from their responsibility, and that's responsibility in moral terms and also in terms of the law. So Alex, our health and safety lead, will talk a little bit more later on about employers' obligations under the Health and Safety Act to protect people from harm. There is a glaring empirical reality here. We would all love to be back to normal, back to face-to-face campus teaching, but we know that it can't happen safely and definitely not for the whole term. If we recognise that, we can prevent inflaming a second wave. If not, our colleges and universities will be part of the problem for the whole population. And in failing to observe lessons from outbreaks in the US college system, senior leaders in further and higher education will be failing. There are big and wealthy US universities who have put in place some very robust measures, including extensive testing, and still been forced to shut. It's an easy lesson to learn. We need to live up to our reputation for rational thinking and really respond to that evidence. So I'm going to hand over to our guests from Independent Sage. We're going to have a presentation and we're going to have a little bit from each person on the panel. And then we're going to go over in the second half of this seminar to questions that will be coming in live from you guys over the social media channels. And some of the things we're going to be focusing on here are things that you can take directly back to your branches to help you in negotiations, to help keep people safe, because we as a union are dedicated to making sure that we give the tools that are needed to our branches, to our members, to force our employers to recognise the very real risks that they themselves are posing to us, to our students, and to the wider populations. Okay, so I think I'm going to hand over to Liz next, is that right?
Is that okay? Can you see that and hear me? Yeah, yes. Great. Okay, So on the 21st of August, Independent Sage published and held its consultation on universities and then published its full statement on the 3rd of September. And on the same day, Sage published its principles for managing coronavirus transmission associated with higher education. And then on the 10th of September, the government updated its guidance for higher education. So in our update today, I want to restate Independent Sage's core messages for higher education, see how Sage and Independent Sage mutually reinforce each other's core messages and how they diverge, and then consider some aspects of the government advice published yesterday. So in terms of what's happened this week, we know that cases of COVID-19 are on the rise in the UK. And we saw on the news yesterday that France is reporting 10,000 infections, Spain 11,000. On the 7th of September, the Health Secretary, Matt Hancock, said that the UK could see a second spike in cases if young people don't follow social distancing rules. We also know from data published yesterday and publicised on the BBC that we can see the cases rising more in the 20 to 39 age group, although we also know from the Chief Scientific Officer yesterday that there are similar rates to this in the 10 to 19 age group, so covering basically further and higher education age groups particularly. But of course, in the context of all of this, we also know from a YouGov poll that 70% of 18 to 24-year-olds wanted to take the pandemic to be taken more seriously. And so there are tensions here around scapegoating young people and at the same time as sort of telling them to not party, also insist that it's everyone's duty to go to the pub. So these are some of the contextual things that have happened this week relevant to what we want to talk about next. So in terms of Independent Sage, we welcomed Sage's principles for managing the coronavirus, and together with their own statement on universities, we think that these documents reinforce each other. Independent Sage agrees with Sage's warnings that there is a significant risk that higher education could amplify local and national transmission, and this requires national oversight, and that it's likely that there will be significant outbreaks associated with HE. And the fact that we all know that younger people are more likely to be asymptomatic in terms of transmission, making things harder to detect. The two documents diverge on the purpose, extent, and duration of an online teaching and learning strategy. So in terms of where we agree, it's really almost all of the core areas. So we agree in terms of having a nationally coordinated response. We agree in terms of things like ventilation. So both documents with different levels of detail emphasise the risks associated with complex and highly varied facilities and infrastructure across universities and colleges. We agree about the importance of clear, concise, consistent communication and encouraging behaviours that are collaborative and social. We agree that an asymptomatic population is making the virus harder to detect. We agree that testing is really important. We need a clear testing and tracing strategy, which is connected nationally and is emphasising on how one will then support those who are sick or self-isolating. We also agree on equalities. Both documents draw attention to the need to ensure access to resources needed to study remotely. We also agree, although talk differently, about mental health and wellbeing issues, so no substantial differences there, and we welcome, in fact, the focus on this matter in the SAGE document rather. And we also agree on general mitigation, so hand washing, social distancing, face coverings, and so on. In terms of where we diverge, while both groups are clear that reducing in-person interaction is a key mitigation, Independent Sage maintains its recommendation to minimise in-person teaching and learning from the start of term, except for laboratory and practice-based programmes with regular review points. I want to draw our attention to issues around segmentation, because segmentation features heavily in both the SAGE guidance and the government's response yesterday. So clearly in-person teaching will reduce the effectiveness of any residential segments that are set up. Indeed, it's likely to breach them entirely. So segmenting recommended by SAGE is highly unlikely to be achievable. Because residential segments are highly unlikely to overlap with multiple teaching group segments, the effectiveness of testing and tracing strategies is increased also by remote learning. For new students who do move to campus and are here on campus already, creating residential segments will be important for the creation of social relationships and for reducing isolation and the associated risks associated with well-being. In terms of the timeline of likely increases in infections, we think there is an inconsistency between the claim in SAGE's executive summary and the modellers in their appendix that a return to campus poses low risk at the start of term. We say that, in short, if UK students were online from the start of term, there would be no or far less risk of the large-scale transmissions that are predicted by SAGE in November and December. Okay, so let's move on to the Department for Education's guidance that was published yesterday or updated yesterday. The document makes reference to SAGE, but is selective and ignores much of the logical upshot and strength of the recommendations in those SAGE principles. So I just want to quote from some of the document. There's a lot to digest in there, but I just want to quote from some key things that are contradictory, create confusion, and show that we really do need a clearer strategy. So first of all, there's a lot in the document in the government that basically hands over responsibility to providers, HE providers, whilst at the same time offering a lot of instruction. It says things like the creation of many new households brings a degree of risk, and we expect providers to take all reasonable actions to minimise the risk, but perhaps not all of the ones that are recommended by independent SAGE. We recognise that for many HE courses, online teaching and learning works effectively and has a high degree of learner engagement. So we note that they do say that. And then it says that universities should identify the appropriate mix of online and face-to-face content for each subject. So this gives leeway, I think, for universities to make sensible decisions. And then it also says that HE providers should have a plan in place that assumes there is likely to be an increase in the number of cases or an outbreak, and to have elements of their provision changeable at very short notice. Some other more specific comments about segmentation, ventilation, and so on. So the government recommends segmentation and says that this could reduce the potential size of outbreaks. But what it also says is what we have noted earlier, which is basically segmentation in terms of course, year group, accommodation, site, and so on, which we think is simply impossible. It's not how students' accommodation and courses work. It also notes that staying within the same household unit will facilitate test and trace activities, which we endorse. But of course, we're saying that as soon as you have lots of in-person teaching, that breaks that effective bubble. It notes that poorly ventilated buildings are particularly conducive to virus spread. But one of the conclusions, if ventilation is not possible, that maybe tuition might be conducted outside. It also, of course, as just noted, has recommended from the 14th of September that there is a legal limit, apart from education, of 6 people who you don't live with that you can meet indoors or outside. It also says that when social distancing is difficult to maintain or good ventilation is difficult to provide, including workshops, laboratories, offices, libraries, and teaching rooms, in other words, all of the buildings that comprise universities, providers can use face coverings, etc., provided that they do not interfere with teaching and learning. And it's interesting that some US news reports on what's happening in American universities are now suspending students who party without a mask, blaming young people and not the university, and just adding to this blame culture for students, but also kind of contradicting things that are in this document from the government. Unless told otherwise, in the event of additional restrictions being imposed locally during the term, students should remain in their current accommodation and not return to their family home, which would increase the risk of transmitting the infection, at the same time as recommending that universities stagger arrivals to avoid large numbers of students travelling at the same time. Just want to, before finishing, draw attention to a couple of headlines from yesterday. So Keele and Staffordshire University say campuses are safe for students despite calls to scrap face-to-face teaching. And one of the comments in the newspaper article, at least, is that bubbles will be provided and that many students will be living in bubbles from the same degree course or academic school. And I think we just want to note again that we think this is just impractical and not actually achievable. We also note some evidence from student preferences around format for teaching, and I think this is positive because what this particular report says is that there is no one preferred method of lecturing, with student feedback reporting positive experiences with in-person, pre-recorded and live online. So the temporary use of 2 to 3 out of these will help universities COVID safe. So in conclusion, Independent Sage recommends that in addition to maximising remote learning generally, the first 2 weeks of term should be online for all courses, including lab and practice-based students programmes, as well as online welcome weeks and restrictions on social activities where feasible. This will enable the communication and implementation of rules, mitigations and so on. Those online welcome weeks will be crucial to make sure that those things happen as much as possible. And this will, as we've said, reduce the number of people in many combinations occupying and travelling between multiple spaces, places, including from residential segments to classrooms and other locations on campus and in the local area, and while travelling to and from campus from other towns and cities. So in sum, maximising remote learning at the start of term will enable subsequent pivots to in-person teaching, depending on infections, rather than away from it if there are cases, and this may mitigate against the late autumn outbreaks that are predicted by SAGE.
Thank you very much, Liz. That was really comprehensive, and I think we're already starting to get questions coming in that we'll come to after we've heard from Anne and from Alex. So can I move over to Anne next, please?
Well, as you said, Liz's contribution there was very comprehensive and really sets out the Independent Sage position and how it differs from others. So I only want to emphasize 2 points. One is that it's crucially important not to blame young people and students as young people for situations that are systemic and that could be avoided if, for example, the Independent Sage recommendations are followed. It doesn't help to take a moral view of students that suggests that they are irresponsible, when indeed many have been so responsible, as we know, and care so much about not fueling outbreaks, even as they do want to continue studying and to be able to see other people. So this is not helpful. And the second point I'd like to highlight is that there are a lot of staff going into universities who themselves are very anxious, and that having more face-to-face teaching means that they have to travel, they have to think about how to manage the situations in which they find themselves, often without proper guidance and help, and that not having face-to-face teaching would make that so much easier for them as well. So it's not just students who we have to think about, but also staff at various levels in the university. And I think anything else I'll come back to.
Thank you very much, Anne. And I'm going to move next to hear from our health and safety lead, Alex Lancaster. And note as well that in the discussion that we're having here, we've made reference to the guidance for universities in England. And of course, the guidance for universities in Scotland is slightly different. So I don't know if you might touch on that, Alex, in your session, but we will also put up a link, I think it's there now, so you can see the different guidance for Scotland if you're watching this live. So over to you, Alex. Thank you very much.
Can you hear me? So yeah, so UCU have put out a range of guidance during the pandemic to branches and to members around how to ensure employers are meeting their obligations under the health and safety legislation. So, you know, it's involved negotiating frameworks, you know, how to negotiate around risk assessments, the sort of hazards and controls that need to be in place, serious and imminent danger procedures, how people can remove themselves from harm, escalation routes when there's failed control measures, etc., such as lack of cleaning, violence in the workplace, all these things that we know do occur. And so, there's been so much advice out there, and the employers are now currently in a range of different positions, dependent upon how much they've taken that on board or how much engagement there's been locally with union branches. And also, we know employers are under a lot of pressure as well from government. And as it's been discussed, there's conflicting messages coming from SAGE as well as from the government guidance itself. And so we do obviously welcome independent SAGE as well, and all the information that they're providing us with to be able to use in our bargaining and negotiations. So, I mean, the positions that employers are taking at the moment range from, having everybody, as many people as possible on campus, full face-to-face teaching, or, a significant amount of face-to-face, to different blended learning models, some better than others, some that are quite minimal and not suitable and sufficient in terms of a risk assessment, and others that are, looking at low numbers of blended learning. And then we do have employers across FE and HE, looking at online delivery models only, or very minimal face-to-face, similar to what is being recommended through IndieSage. So, as a union, we're in the position where we feel like there's a significant change. Infection rates are on the increase, particularly in the cohorts that we're going to be teaching or working with. There's going to be increases in local transmission rates, and the track and trace system itself is currently failing. And although we do welcome employers' moves towards increasing testing, we do have concerns that it's not linked into any national monitoring and track and trace programs, and linking in with local authorities and public health teams to ensure that, the spread of that infection in the local community is also controlled. And while we might be able to test some students, whether that is at the adequate level, or and also how that is then impacting on those communities, we will not know, because the track and trace system is just not fit for purpose. And so we are in a very high risk situation at the moment. And for that, we are really pushing hard for employers to take a precautionary approach, as is required of them under the health and safety legislation. So government guidance may be coming out and asking employers to, try and move to full face-to-face teaching. But the government guidance is also saying they should still, protect workers from harm, have a COVID secure workplace, and meet their duties under the health and safety legislation. And they can't do both of those things at the same time because of the situation we're in. And so the law takes precedence here, and the employers should be following health and safety legislation and the regulations that fall within that. And it's up to, unfortunately, our branches and our reps to really push those arguments and really emphasize the business case, the legal case, and the moral case as well, because of the impact this is going to have on public health more broadly. So the significant change alone requires that employers have to review their risk assessments in consultation with trade union, health and safety reps, and trade unions as a whole. And as such, we would expect there to be a pause and there to be a review of all the risk assessments that are currently in place, and the operation delivery plans that come as part of that. So we see it as quite a significant danger to our members if employers are not significantly scaling back the face-to-face delivery. We have never felt that we would be in a position in September where there could be any significant numbers being taught. And if anything, we were hoping that employers would gradually phase the low-risk areas back, keeping an eye on local infection rates and how effective the track and trace system is, and constantly monitoring and reviewing the effectiveness of those control measures that they put in place. And that is just not happening at the moment for a variety of reasons. So employers are under increasing pressure to implement, the latest Department for Education guidance. But, as has been indicated, this is very contradictory in terms of the latest science and data that we've got coming out. And so what we really want to do is get branches to review these risk assessments and really push hard for employers to start, coming back to basically the start, because we're in a high-risk situation, of removing people from face-to-face teaching unless it's essential to do so, and even then, only if it's safe to do so. So, you know, you can look back at our guidance on this for more information if you think that's helpful. In terms of employers that are just not consulting with branches or, you know, are just putting individuals at extreme risk, the UCU are going to put out some guidance next week, which will help branches understand how they can escalate collectively and individually. And there will be template letters and guidance for branches to issue to the members who are in particular situations that where they're at increased risk or being placed in dangerous situations. Now, a lot of talk is taking place around Section 44 of the Employment Rights Act, and this is obviously an individual right for anyone to remove themselves from a situation of serious or imminent danger. Now, the problem with Section 44 for us as a union is that we can't be seen to incite members to follow Section 44 of the Employment Rights Act in any collective form, because legally that would be inciting unlawful industrial action. And so while individuals do still retain that right under Section 44, we feel it's stronger that local branches negotiate serious and imminent danger procedures, which is required under Regulation 8 of the Management of Health and Safety at Work regs. And this is much more powerful because it's negotiated with unions, and it again is something that members are aware of, an escalation process, something they can follow when there is a case of serious and imminent danger. Now, obviously, when we consider serious and imminent danger, you know, we might think of a failed control measure like cleaning after a case of COVID-19 has failed, or, you know, there's been an attack on a member of staff. And, you know, we would want staff to be aware of how to remove themselves from that serious and imminent danger, and that the employer has agreed that procedure in advance so that we're not putting our members at any risk of disciplinary action if employers disagree that there's a serious and imminent danger, for instance. So we also, where branches just don't agree with the employer's position and the employer is really forcing them to, you know, return to face-to-face teaching, we need them to be clear on the failings in the risk assessment. We need them to identify all the failings and what the remedy would be to address that. And, you know, as part of that, we can have discussions around the employer's business case for moving to face-to-face teaching and delivery. And we can also look at, you know, the wider issues that we've got around track and trace, local infection rates, individual vulnerabilities of people. And, you know, we will be putting out, as I said earlier, template letters for individuals as well who do feel at increased risk for various reasons, including, you know, they may be from Black, Asian and minority ethnic groups, they might be pregnant women, you know, might be disabled staff who are at increased risk of exacerbation of their ill health. And it's really important that while we're also protecting the individual, we are also understanding as a collective how we can support members as well. And so we will be putting out advice in both regards. So branches, you know, if you've pointed out all your risk assessment failures, the employer's still not playing ball, we do want you to escalate, and the regional office and the union will support you with this. We do have processes for in our recognition agreements with failure to agree, where we can campaign and escalate local disputes where we need to do so to protect people. And ultimately, you know, the employer has to remember that it's their duty to protect people from harm, anyone who comes into contact with their undertaking, and more broadly, because we are in a public health crisis, they have to look at their own public responsibility to the local communities within which they operate, and the impact on you know, infrastructure in those areas as well, such as the health service and transport and so on. And so I'll probably leave it there, but that's just a summary of where we believe we are at the moment, the advice that we've given so far, and the advice we will be giving in the next week.
Thanks so much, Alex. And just while we've been on air, there's been breaking news about the rise in infections having surged in England a huge amount in the last few days. In fact, it says that it has soared by 60%, with 3,200 new cases now being seen each day, according to official estimates. So this is the context that we're working within. And we've had some really great questions coming through already. Please do keep your questions coming in the comments underneath the video. The first question that we've had is a very good one from Camilla Royal around halls of residence, asking, does the DfE think that all students live in halls of residence? What about students who live with parents or spouses and kids, etc., etc.? So I'm going to open that question up to anyone on the panel who wants to answer it. I'm just going to see who would like to come in on that first. Do you want to just put your finger up? Okay, okay, brilliant, thanks. Can we go over to Liz then, please?
Obviously, I can't speak for the DfE, but I think it's really clear that the answer is no, that they don't seem to understand how the basics of how students live in wherever, whether they live at home, whether they live in town, whether they live in halls, and how basically that is going to work when it comes to, even if you can create residential bubbles wherever people are living, that isn't going to work for moving around campus to in-person teaching. So I think it's very naive for that to be a recommendation. I think it's a naive set of headlines that we've seen around universities saying we're creating segments, because I just can't understand how that would work in practice.
Liz, and Anne, we'll come to you next. And I wonder as well, do you think it's also naive that perhaps the DfE might be assuming that all students study exactly the same modules as each other on single honours courses, when we know it's much more diverse than that?
Well, exactly, and I think the headline that I put up earlier about Keele and Stafford sort of saying that they were going to segment on the basis of a college, an academic school, or a course or a programme. I mean, you know, right there is all of the problems that we just, it doesn't work that way.
Yeah, I think it's a really important point that not only do all students not live in hall of residences, they're different, but different universities have different numbers of students living out with their own children or with parents and so on. And so this could easily become a situation where, if there is an uptick in a local area of infections, that one gets all sorts of blaming of particular groups of students, for example, by ethnicity. And I think that it is very easily a situation where different universities and different groups of students become stigmatized because of their situations and those not being recognized in the first place.
Thanks very much. And I think what you've just said, Anne, segues really well into the next question that we've had around the anxiety that and the frightened feeling that many members have about returning to work. But of course, many students will also be experiencing that as well. So Simon Tull has asked, as a clinically vulnerable member of staff in FE, I am being pressured to return to teach face-to-face. I don't feel safe, but I fear for my job. What are my options? And I think it might make sense for us to come to Alex first on that question, if that's okay, Alex.
Yeah, of course. So, I mean, the obvious answer is to request an individual risk assessment and to make sure that that is suitable and sufficient. So you're identifying all the potential risks to you that may occur, not just as someone who's clinically vulnerable. I mean, there's lots of other risk factors that we need to take into account. And they also need to look at your mental health as well, and the impact that forcing someone back to the workplace when they don't feel safe can have on your mental health, and how it can also potentially exacerbate any disability that you may have already. And so, you know, the employer has a duty of care to protect you from harm, and that's physical, mental. And then, you know, we just need to, I'm unclear on whether the branch would think the generic risk assessment was suitable and sufficient, but most certainly anybody who is clinically vulnerable should be having their own individual risk assessment, and you should be highlighting all the potential risk factors, not just in the workplace, but even linking to your family environment and the risks there, and also any travel to work and so on.
Thanks very much. And I'm going to ask Liz to come in on this point as well, if that's okay, Liz.
Yeah, I think more generally, the less risky option of remote teaching for a while longer has slowly morphed into a way to categorize people as anxious and in need of reassurance and support, which I think is problematic. Should we be supporting people to do something that is objectively riskier than doing something else when the something else is equally doable, equally effective, and fingers crossed temporary? Because we're not talking about supporting someone to overcome a phobia or climb a steep mountain. So I think it's really important that we don't pathologize and individualize people as anxious and divide them into categories of comfortable or irrational or reluctant or anxious, and just simply remember the fact that COVID-19 is a deadly novel virus with yet unknown long COVID consequences that has killed, depending on your data source, many thousands of the UK population.
Thank you. And I think what you're saying and what we're saying here in general is really important around how confidence and anxiety can be weaponized in this context, that language can really be weaponized. And we're seeing a situation where students who are being encouraged to believe in this increasingly fictional notion of COVID safety on campus will then, as you've said, be blamed if they, behave as students will behave and if they are having to interact with each other. And I think it'd be really interesting as well to hear from any people watching this who have had coronavirus or perhaps are suffering, as I am actually, with a kind of long form of COVID with those after effects, because we are looking at the risks to life and we're also looking at the risks to long-term health on campus, aren't we? And in terms of anxiety, we've seen lots of people who are suffering with long COVID or the after effects of post-COVID fatigue as being pathologized as being anxious rather than even still suffering with those kinds of symptoms. So I'm just wondering if perhaps you might like to comment on that, and we'll see if we have any questions coming through from members on these. We have, in fact, somebody saying that they have symptoms and have been unable to get a test. We've seen people saying they are based in places like London and Manchester being asked to drive as far as Scotland to get a test. And so all of this connects together, doesn't it, with the idea that we might be able to provide COVID-safe campuses actually being contradicted by what's actually possible in terms of the infrastructure. I can see you nodding, Liz, and I wonder if you'd like to come in on that point around the testing and how that relates to anxiety and infrastructure.
I think I just echo the points made earlier, really, that testing, you would hope that it wouldn't be just by virtue of whether or not a university can afford to buy and actually obtain testing, and then what are you testing for, and all of those testing strategy issues are covered more carefully in the document. I was just thinking a bit about the long COVID, which again anybody can look at the evidence that's unfolding all the time, and I'm just quoting from Dr. Nisreen Alwan, who talks a lot about how, of course, death is not the only thing to count in the pandemic. We must count lives changed, and we must know much more about long COVID before we start to get on top of the virus, but also in terms of the manifestations of those things for people on campus at universities, both staff and students. Yeah, I don't have anything more to say. I'm not a medic in this sense, but clearly it's not a matter of whether people die or not of coronavirus.
Thank you. And as you've been speaking, we've been having people echoing these points. I'm going to come to Anne next, if that's okay.
And I just want to say that I think that in this, UCU's role is absolutely crucial, because one way to avoid the individualizing, while recognizing that people have very real reasons for feeling the way they do about return to university, is to see it as a collaborative process, just as universities ought to really be thinking about how can they come together to come up with sensible options in this setting. So too, I think that as members of UCU, we need to see ourselves as having a common fate, and therefore think about how we deal with it together across universities and so on.
Thank you. We're getting a lot of questions around how people can push back against the issues that they're experiencing at their institutions. And I think this connects very strongly to what you've just said, Anne, about the need for collaboration. So we're hearing questions like, you know, for example, I think it was B who asked a question just now, B Hughes, asked about where their institution is not recognising the risk, for example, that travel to and from campus is posing. How can they push back? That's up on the screen now. The university refusing to acknowledge the bearing it has on individual risk and how that connects with their duty of care. So if it's okay to come to Alex to kind of look at those kinds of questions, we're getting a lot around how can we push back where we're saying these things as a branch and they're not being heard by the institution.
Yeah, I mean, it's really difficult because, you know, as much as we rely on legislation to make our case, we do rely on our local bargaining and negotiation and getting people on board and using data around travel to and from work and the risks linked to that is really essential when we're negotiating with employers. You know, there will be, you know, the employer's responsible for their workplace, and travel to work hasn't really come up as an issue until we were in the middle of a public health crisis. And employers do have a public duty in that regard to protect public health, not just the health of their employees and anyone who comes into contact with their business. And so the routes into work and the travel to and from work becomes more and more significant, because essentially we're having people traveling who are potentially spreading the virus or at greater risk of contracting the virus because they're traveling on public transport in close quarters with other people where there's poor ventilation, and the evidence speaks for itself on that. So do employers really want people placing themselves in high risk situations and bringing an infection into their workplaces where it will likely lead to a local lockdown or a local closure of that institution and affect their business more significantly? So, you know, we can make business arguments, we can make the fact that it will disrupt the education of students, and we can try and bring other unions on board and students into our campaigns when we're challenging employers on all of these issues. And for me, there is no reason why an employer shouldn't be including that. And I would say the majority of employers have accepted that point from my understanding.
Thanks, Alex. And I think it's really important here to note that in terms of safety on campus and in terms of working as UCU with other campus unions and thinking about also working with students and the student unions, everyone will be safer, staff and students will be safer, the fewer the people that are on campus. And we're seeing a question pop up that I would like to relate to this, which is how does this work for casualised staff and other campus staff who feel pressure to attend? So what we're arguing is very much that people will be safer and it will be much easier to mitigate the risks of those staff who do have to be on campus. So for example, there was a meeting that Goldsmiths UCU called yesterday, which was a community-based meeting. So it brought together people from different job types, it brought together people from the community, it brought together councillors and local MP. And they were talking about, it's all very well emphasising the need for deep cleaning of the campus, but actually the people who are taking on that work, the cleaners, will be safer the fewer people that are on campus. So we really do need to think of this as a whole community issue, the community within the university and the community the university sits inside. Now, when we're talking about measures that can be taken, such as deep cleaning and so on and so forth, I think this is picked up in the independent SAGE and SAGE report, actually, the variety of building types on a campus. And I just wonder if you might be able to comment on that, either Anne or Liz, around how your thinking on that connects to the points you've been making about the need for national coordination, because what we're not seeing is one clear line. Universities are not doing the same things as each other, and if anything, they seem to be prioritising competition with each other in terms of what they're saying about student experience over community safety. Liz?
Yeah, I mean, I think there's obviously a strange blend in the government document yesterday around autonomy for universities, whilst also pressing advice and strategies. We can see, we just know locally, and by talking to all of our colleagues that different universities might be taking slightly different approaches, and as soon as the guidance is fuzzy, then even in terms of translating what would amount to the right amount of in-person versus online teaching, as universities are trying to manage that, is really unclear. I think also the issue of casualised staff that was raised in the chat is not only might those people feel more pressure to come to campus, but they're also probably more likely to have multiple jobs at different universities. So then the pressure is not only to attend one campus, but perhaps many, maybe on public transport systems as well. So all of that feels, wrong and far more risky for those individuals. And then I think the final point really is one that we made last time in Independence Age, which is that lots of people do need to be on campus to keep the lights on and keep universities going. And of course, there are lots of students on campus who didn't travel home during lockdown. And so a lot of activity is still, of course, been going on throughout the whole period in universities. But the fewer people that are there, the fewer people everyone has to navigate, clean for, pick up after, avoid, challenge if people aren't following guidance and all the rest of it. So all of these things are connected.
Thank you. And I wonder if, building on that, oh, brilliant. Anne, would you like to come in? And I'd be really interested if you could comment on where you have highlighted the differences between your report and the SAGE report around the timescales and how early we expect to see the implications of if we do go back to lots of face-to-face teaching in universities and continue with it in colleges.
I wanted to say something around the fact that many of our colleagues have been working really, really hard to try to mitigate the consequences of having to do face-to-face teaching, trying to make buildings safe and so on. And I think that the effort would be much better spent in thinking about what a really good online offer looks like for different subjects. Because not only are they having to do that, trying to think about what it would look like to have students around, how to maintain bubbles and segmentation and so on, but they also have to think about how to do online teaching well. And we know, Liz said earlier, that the evidence is that students are really happy with online teaching. We also know that not all face-to-face teaching is very good. So universities would be much better putting their efforts and time into getting outstanding online teaching. And Liz might want to say a bit more about that. But in terms of timing, one of the reasons that we've asked for everyone to have everything online for 2 weeks is obviously this is quite a crucial point where if people move together, those first 2 weeks are frequently the time within which in the United States they've found that they have to close down universities because there've been outbreaks, 9 days to 2 weeks. So that's obviously a really key point.
Thank you. And again, picking up on the fact that we have empirical evidence from the US that we should be paying attention to. Liz, would you like to comment on that point as well?
Only just to reiterate the issue of the online first 2 weeks, and especially given what you reported just now about breaking news and rates increasing all the time. If we do that, then what we might hopefully do is mitigate outbreaks. And you might have seen from the SAGE document that they're predicting, well, they're predicting low, they're saying low risk at the moment, but outbreaks in November, December. And what we're saying is if you maximize online now, then you might be able to mitigate or perhaps, remove entirely large peaks on university campuses in November and December.
Thank you. And I've now got quite a big question, I think, that did come up on the screen just a moment ago. This is a question from Ant O'Hanlon, which is, for branches that have already rejected risk assessments, timescales for escalating this into an industrial dispute would not prevent staff from being potentially forced onto campus. So will the guidance that has been noted is coming out soon provide branches the tools to defend members from being forced to return to campus without an industrial ballot? So I think that's one for you, Alex.
Yeah, I mean, it has to, doesn't it? Because there's so many limitations with industrial action. There's limitations with using legislation as well. You know, we experience these barriers all the time. I think what we always fall back on is our local campaigning and organising strength in branches and our effectiveness at negotiating locally. And so the guidance is going to talk about all the different steps that we expect branches to take in various different scenarios. So if you've rejected the risk assessment and the employer is still, you know, not acknowledging your counter arguments and things like that, then we'll have a process that branches can follow. And we hope to have an infographic as well to make that a little bit easier to understand. And I think, you know, the discussion around moving to failure to agree and ballot is obviously in the most extreme cases. And it's really to protect members' positions if we do get into a difficult legal position where we can't allow people to go into the workplace because it's so unsafe. But obviously, we always hope to avoid any kind of dispute through collective bargaining. And we do have a lot of evidence to support our collective bargaining. It's, you know, even the government's own SAGE report is now coming out with a lot of the arguments we've been making for a long time. And so, you know, we do have a lot more power than we maybe did even just a couple of weeks ago. And so we do need to go back to the table and really push these arguments. And hopefully the guidance will support branches to do that as well and give them how to escalate through the different stages.
Thanks very much for that, Alex. And I think that what we're really hearing about in the comments and questions coming through is the level of incredulity from our members at what they're facing when they're trying to navigate this idea of returning to face too early. And now an example was raised with me yesterday, and it's been in the media that Exeter University has been making quite a big deal out of the fact that they are providing tests for students. And this is being badged as something that is a good safety measure. I have worries about that because it seems that they're not testing the asymptomatic population, and there is a reliance on having given students thermometers to take their temperature. And we know that not every case of coronavirus is necessarily going to be accompanied by a high spike in temperature, certainly not at the beginning. And I'd like to come to Anne and Liz about this, because you were talking about the importance of a coordination of testing. Now we're seeing a collapsed track and trace system that never really got off the ground. Where do you see the university's responsibilities in that picture? Anne?
Okay. I think that it's crucial that university testing is part of local health measures so that it's not isolated in itself. I mean, most universities could not afford to do good testing in the ways that would be necessary anyway. And we ought to see the university as part of its local population. Having said that, the way that testing is at the moment, it takes a long time in Britain for results to come through. And we know that there has been very poor response rates to calls to isolate. And we have to see testing as part of the find, track, trace, isolate process. And this is just not happening. I mean, so I think it's important that there's national coordination between universities, that universities see themselves as part of the local population, which will stop outbreaks being blamed on particular universities and so on. And that the much bigger and more serious point that there shouldn't be face-to-face teaching except where it's absolutely necessary for lab-based classes, for example, is key here. And one other thing that I would say is that the Independent SAGE report stresses that it's important to review this. So it's not that we're saying that this is once and for all. If there's a miracle and suddenly there's a vaccination found before Christmas, then of course, if everybody's had that vaccination, we would say something different. So that there have to be points for review, and we welcome that. So it's not that we're being absolutist about the argument.
Thank you. And I'd really like to ask Alex to come in on this issue as well, and maybe think about the advice that we've seen about tiering.
Yeah, so the government advice around tiering in my opinion, is, completely back to front. So, we would expect to start off in a position of, precaution and prevention, where, we are teaching online and there's minimal staff on site, minimal students on site. And then as infection rates decrease and transmission rates increase, we gradually open up the campuses and move more and more towards face-to-face teaching. And, it almost seems like common sense, doesn't it? Because these are models that are adopted elsewhere. You just have to look at other sectors in the UK or other countries, and these are the models they adopt, how you gradually open up workplaces. And instead, we're in a situation where we're in a high-risk period, and infection rates are rising daily. There's a mass movement of people across the country. They're moving to areas that are in partial lockdown, and we are bringing all these people together to deliver face-to-face education, and it just seems like there's no real business argument there. And if anything, we're going to end up in a really tragic situation where we see lots more deaths and lots more illness and long-term impact from this. And I think when branches look at those tiers in the DfE guidance, we really need to think of where we currently believe we are sitting at the moment in those tiers, and try and make our arguments as well from that point of view.
Thank you, Alex. Now, we could carry on talking, I think, for probably another hour, but in fact, we have another 4 minutes. So what I'm going to ask each member of the panel to do is just spend a minute summing up what you think the key messages are at this stage for the leaders of colleges and universities to be taking on board. And Alex, I think a lot of questions are coming up around, the potential for lodging disputes and so on and so forth. So if you could maybe think about that in your summing up, that would be really great. So Anne, let's start with you. Anne, I'm so sorry, you're muted.
The key message is one that's been made again and again, that at this moment, we must have online teaching, and that should be seen as the standard, and that universities should not bring everybody back for face-to-face teaching. That's absolutely key. And that it's important, of course, that universities are trying to think about mitigations, segmentation and so on. But I think that as Liz showed in her talk earlier, and as the reports show, these just are not really feasible for stopping outbreaks. So the key thing to focus on is that universities should, where they're intending to do face-to-face teaching, should really change their minds.
Thank you very much. And Liz, if we could come to you next for a sum up your key message.
The same key message, obviously, as Anne. I would just add to that when you compare the SAGE document and the independent SAGE document, and we've tried to do a mapping in the version that we've put onto the website of that. There's a lot in there that is the same. And that it doesn't necessarily find its way into the government advice. So I think it's really just important to scrutinise the document, and we've tried to enable that a bit by doing the comparison between the SAGE and independent SAGE documents, and minimising face-to-face in-person teaching will simply help maximise the effectiveness of other strategies, whether it be testing, however that happens, and segmentation. So yeah, that's the message that we want to make sure is clear at the end of today.
Thank you very much. And Alex, noting the great amount of comments that have come in with people worrying about whether they're going to need to move into dispute and how quickly they'll need to move, I'm going to ask you to do your 1 minute summary as well. Thanks.
Okay, so echoing obviously what Liz and Anne have said already, and using all of that new evidence that's been pulled together in a really easy format for us, and using that in our collective bargaining negotiations to improve risk assessments, to get them reviewed, to halt any further expansion or face-to-face teaching, to get employers to pause, come back to the negotiating table, and to discuss with us the best way forward, which obviously we believe is maximising online teaching delivery and minimising attendance on campuses, and that includes HE and FE as well. I appreciate there's different elements that we need to consider in both regards, but these are the key messages, and we need to act quickly and keep in contact with regional officers so that you can be guided through any escalation process that you may need to follow, so that you can protect the health and safety of your members. I think that's the key message for me, is that we really need to use all this information now.
Thanks very much, Alex. So it falls to me to try and sum up from this whole event, one that we could keep going much longer. But I think what we really have been talking about here is the importance of leadership. Now, we have been arguing for the whole summer for a proper bailout for universities. We've been arguing for guaranteed funding for colleges to make sure that they can continue to serve our communities and maintain a wide provision of education and academic autonomy. That's still needed, and employers would do much better to work with us as a union and to work with us and other unions on protecting the health, lives and livelihoods of students, staff and wider communities, rather than continuing to try to compete on the grounds of what they believe they can deliver in terms of student experience. So we need to get rid of these notions of safety in the current situation that we're in with a collapsed test and tracing system, focus on the civic responsibilities of these institutions and keep fighting. Now, we have another event that I just want to plug before we go, which is part of the TUC Fringe programme, which will be happening on Monday. I believe that's at 2 p.m. So we will again be joined by members of Independent Sage, and we'll also be joined by, I believe, an MP as well from Labour. So please do tune into that. There'll be details of that online. If you've joined us for this live, thank you very much. If we didn't get to your questions, I'm very sorry. We've tried to summarise as many different themes as we can. Please keep contact with us. Please keep writing in. And thank you very much, everyone. We'll see you again soon.